Welcome back to Pharma Palette. In the previous video, we discussed the types of synovial joints, their names with easy tricks, and also we saw the general characteristics of synovial joints with a diagram. But today, we will go deeper into each type. We will look at all six types of synovial joints in detail with examples and the diagram so that you can understand them clearly and write a perfect answer for the exam. So there are total six types of synovial joints that will be allowing the body to move in variety of ways. And to remember all the six types, I already said in the previous videos that remember this trick so that you'll remember every name. First type is plain joint. This is also called as the gliding joint. Coming to the diagram, this is how it looks. And this plain joint, it is small and it is tightly constricted. Based on their shape, they can allow multiple movements that can also include rotations. That's why these are functionally classified into the multi-axial joints. Now we have to see what are the examples of this. These are present between the carpal bones, or this can also be present between tarsal bones. So the second type of joint is called as hinge joint and it will be looking like this. Coming to the points under this, so this will be allowing both bending and straightening motions, and that too through the single axis. That is the reason this will be functionally classified as the uniaxial joint. Coming back to the examples, elbow joint. Elbow joint is nothing but it is between the humerus bone and the ulna bone. And some other examples include the knee joint or ankle joint. So the third type of joint is the pivot joint. So here I have drawn two diagrams. So this first one, this one we will be calling it as the head of radius. This part is called as the radial notch. And this bone is ulna bone and this one is radius bone. And this is the angular ligament. So this one we can call it as the proximal radio-ulnar joint. So this one is one of the example, and the second one is this is between the C1 and C2 vertebrae. So here we can see that it is having a rounded portion and that is also enclosed with a ring. This one. This bone will be rotating, that too in the single axis. So this bone will be rotating in the single axis, that too within the ring. When it is rotating in the single axis, that particular joint will be functionally classified under the uniaxial joint. So it is also called as the uniaxial diarthrosis. All points you will include here. First thing is you will draw two diagrams and then you will be writing two examples. One is the proximal radio-ulnar joint and the other one is between the C1 and C2 vertebrae. So here the pivot joint will be present. Then you will describe this diagram. That means it is a rounded portion. It is enclosed within the ring and there is a bone which will be rotating within this ring, that too in this single axis. So that single axis movement we will be calling it as a uniaxial joint or uniaxial diarthrosis. So that much is enough for this joint. The fourth type of synovial joint is the condyloid joint. This is also called as the ellipsoid joint. Here the articulation area has more oval shape. Biaxial, it comes under the biaxial class because here the movement is allowed in the two planes. So one of the movement is the bending and straightening of fingers and the second movement is side to side movement. Coming to its diagram, it will be looking like this, and here we can take the example of radius and carpal bones of the wrist. So the fifth type of joint is the saddle joint. So this is how it will be looking. As the example of the saddle joint is, it is present between the carpal bone and the first metacarpal bone. There are some other examples. So other one could be the sternoclavicular joint. And here there will be concave surface in one direction and convex surface in the other direction. That's why these will be coming under the functional classification of biaxial joints. So the sixth type and the last type of the synovial joint is the ball and socket joint. And the diagram of this will be looking like this. So this will be having a rounded head of a bone, and also this will be fitting into this concave articulation that will be looking like a socket. And the points to be included are, this will be having a rounded head of one bone. This will be fitting into a concave articulation which looks like a socket. And this will be functionally classified under the multi-axial joints because it will be showing a greater range of motions. Coming to the examples, it is a hip joint and the other one is the shoulder joint. That's all about the types of synovial joints with examples and diagram. To conclude, synovial joints are the most common and freely movable joints in our body. By writing the six types in detail, adding their examples, and drawing the labeled diagram, your answer will be complete and enough to score full marks in the exam.